The young kids are very susceptible to overuse injuries. Their tendons aren't mature, their joints aren't mature. There's sometimes a muscle joint, muscle tendon imbalance. As the kid gets older, they're doing some things that are adult-like, but their structure is still juvenile. The potential is very real, and unfortunately we see it very frequently. To give the shortest answer possible, and probably an answer that's as correct as any, they need to take a month off. And some of the most successful athletes in the country don't follow the 12-month a year, my kid has to go to every showcase and every practice model. They're smart enough to have their kids take time off because they know that when they were in the minor leagues, that there were players with whom they played who were immensely talented, but they had a shoulder that was dinged up a little bit, an elbow that was dinged up, a knee that was dinged up, and they never made it because of a lingering overuse injury. And those overuse injuries start sometimes at 11 or 12 years old. It depends what the sport is. For throwing sports, it's knees and shoulder injury. For running sports, soccer is a good example, it's stress fractures, it's bony overuse injuries. And they can occur with kids as young as 8 or 10 years old. Then there's other sports such as gymnastics. Gymnastics, you can get overuse injuries in which young people have injuries to their shoulder and their elbow because of landing on a shoulder and elbow as a weight-bearing joint, and it's not meant to be landed on. It's not a weight-bearing joint. The thing that's happened in the last 4 or 5 years is they've gotten very scientific about pitch counts. And even here in the Fisher Cats, if we have a major league player down for a rehab assignment, he's on a strict pitch count and literally will come out in the middle of a count to a batter. So it could be 2 and 2, and if he's thrown his 70 pitches, he's out. So for little leaguers, pitch count's very important. Number of innings pitched is very important, and rest between appearances is very important. The people who probably are at the most risk to ignore those guidelines are not the coaches, because they will forfeit a game if they pitch a kid who's had too many innings or too many pitches, and it's monitored. It's the between games. It's what your child does between games. So if you're a dad and your kid's a great pitcher and he pitched on Tuesday, on Wednesday, he ought to read a book, maybe do some stretching exercises, which are easily accessible in any sports medicine website, but not throw. It's really the between games, the unregulated throwing that can hurt a kid like that. Baseball, in terms of throwing, is one of the best regulated right now. And they impose those rules on coaches. It's the running sports where no one's saying how many wind sprints you can do, no one's saying how many suicides in basketball you can do. And in that case, in the running sports, the stress fracture is the most typical thing we see. And the stress fracture occurs insidiously, slowly. So it's not one moment where that young person will all of a sudden develop pain. It develops slowly, and they can often perform pretty well, but they have achy pain that doesn't go away, and at its worst, it can result in a frank fracture, a broken leg. It's hard sometimes because if there's a critical time of the year and somebody's 70% recovered and there's a big game, I understand that, and the temptation to play is there, and sometimes it's appropriate. For example, if someone has some leg pain and they might have a brewing stress fracture and they have the state championship in a week, it might make some sense to, if it's not clearly a stress fracture, but maybe just a shin splint at that point, it's hard to argue that they shouldn't play in that last game because a week from now, they take their jersey off for the last time. But if they have real pain and it's ongoing pain, and especially if you see something such as a limp in a runner or a baseball pitcher just between innings doing that with the shoulder, that's a real sign that even subconsciously a person knows they're hurt and they shouldn't play anymore. And they'll be back if they let it heal. So one of the most interesting things about stress injuries, whether it's muscles or ligaments, is that in baseball pitching, there's a theory that probably is quite accurate, that the baseball pitchers who didn't have early great success, they weren't phenoms when they were 18 and 19. It took them until they were 23, 24 to be in a starting rotation. They last longer than the 17, 18, and 19-year-old phenoms because they didn't pitch that many innings. The nice thing about signs in terms of overuse injuries is that your body speaks up. Your body won't suffer in silence. There are some diseases that other doctors take care of and I don't, that are silent killers. Hypertension, diabetes, certain forms of cancer, they won't speak up. The nice thing about overuse musculoskeletal injuries is if you're paying attention, your body will tell you that it's had enough and it needs a rest.